Ever wonder what happens during the ninth month of pregnancy? It's a time of rapid growth for the baby and a period of significant change for the expectant mother. During these 4 weeks, which span from week 33 to 36 or beyond, the baby is busy preparing for birth. One of the most noticeable changes during this time is an increase in the baby's movement. As the baby grows, it has less space to wiggle around, so while the movements might feel different, they will be more frequent. Around this time, you might also begin to experience Braxton Hicks contractions. These practice contractions help prepare the uterus for labor. Don't be alarmed if they become more frequent and intense as you near your due date. As the baby drops lower into the pelvis in preparation for birth, a process called lightening, expect to feel increased pressure on your pelvis, bladder, and lower abdomen. This can lead to discomfort and even a persistent backache, especially as your belly grows larger. Swelling, particularly in the feet, ankles, and hands, may become more noticeable as your body retains more fluids. And as the baby grows larger, it can push against your diaphragm, making it difficult to breathe deeply. This can lead to shortness of breath. You may also experience heartburn and indigestion as the growing uterus pushes against the stomach. And as your body prepares for labor and delivery, don't be surprised if you feel more tired than usual. It's not all physical changes, though. Some women experience a sudden burst of energy and an urge to clean and organize their home. This is known as nesting. And lastly, you may notice cervical changes. Your cervix may start to soften, thin out, and open in preparation for labor. Throughout all of these changes, it's important to keep in close contact with your healthcare provider. If you experience any concerning symptoms such as severe or persistent pain, vaginal bleeding, or a decrease in fetal movement, reach out to them immediately. In conclusion, the ninth month of pregnancy is a time of preparation and change. It's a time of increased fetal movement, Braxton Hicks contractions, and various physical discomforts such as pelvic pressure, backaches, and swelling. It's also a time when you may experience nesting instincts and cervical changes. And through it all, remember to stay in close communication with your healthcare provider to ensure a safe and healthy pregnancy journey.